You're listening to the Holistic Nootropics Podcast, your home for holistic, evidence-based cognitive enhancement strategies.
Dr. Greenblatt, thank you so much for joining me today on the Holistic Nootropics Podcast.
My pleasure to be here. Thanks for inviting me.
Yes. So I want to jump right into it here. Let me ask you this. Why is functional medicine a better option for treating ADHD than traditional allopathic medicine?
I think the treatment of ADHD has pretty much changed over the last 100 years, every 10 or 20 years, based on how we describe the disorder. You know, for years, we thought it was brain damage and then minimal brain damage and then hyperactivity with or without attention. So we keep changing the name, and treatment changed. But the treatment model in traditional psychiatry has always been symptomatic-based care, right? We have medicines to contain the symptoms. And a functional medicine model looks at the underlying cause. And I believe that is really the only way to treat ADHD.
And when you say underlying cause, what does that mean exactly?
Well, good question, because I think people throw that term out a lot without really understanding it. And I think the most important thing we can start with is that ADHD is likely a genetic disorder. It is a neurobiological disorder. The neurochemistry is different. The brain structure and genetics are different. And so we need to respect that. But there are many environmental factors that can contribute to some of the symptoms. And a functional medicine approach looks to determine as many underlying nutritional or biological factors to treat ADHD. Sometimes we find 1, 2, 10, sometimes we don't find anything. And I'm not opposed to medication, that symptomatic Band-Aid, if you will. But first, our approach is always looking at a functional medicine model, looking at the underlying cause.
If there's one thing that I've learned since I've been researching ADHD, and I write a lot about ADHD, and I can't decide, is it a mental disorder? Is it a mental illness? How would you characterize it?
You know, I use the frame medical disorder, a neurobiological disorder, because so many of the kids and adults that are suffering with this disorder, these symptoms, they're not in control of their impulses sometimes. They're not able to focus their attention. So it's not a behavior problem. It's not a, I don't want to pay attention problem. It is my brain can't pay attention problem. And that's why we need to address it biologically, because I believe it is a neurobiological problem.
Yeah, it feels like a thing that there's so many aspects to it. And that's my personal issue with the allopathic approach, which is it's very like symptom, drug, symptom, drug, symptom, drug. And what I like about functional medicine is it addresses these multifactorial factors that come into what causes this thing of ADHD. And maybe for a lot of people who address themselves as having ADHD or have been prescribed ADHD medication or have been diagnosed with ADHD might not have the actual disorder of ADHD, rather more like symptoms like ADHD, but we're still treating everybody the same.
Absolutely. I mean, I think anybody that's not paying attention, either parents or kids or doctors, will just use terms like ADHD. I work with patients with eating disorders that malnourished, starving, and they can't pay attention because they're malnourished. And people would give them medications and call it ADHD. So it is important that a diagnosis is made so we understand how to treat.
So do you find diet, because you're mentioning, children who are malnourished, and I find in the nutrition world that it's, what is it? Overfed and starving to death, where it's not a matter of they're not eating enough calories. It's just the calories they're eating are devoid of a lot of nutrition. Do you see a lot of that in your practice?
Every day for the past 35 years. Yes, absolutely. That's kind of the driving kind of path that we took many years ago. I've been talking about this for 30 years, and I wrote the book about 3 or 4 years ago because there was now research to support it. So we now have research that there are profound nutritional deficiencies associated with ADHD.
And your book you're mentioning, is that finally focused?
Yes, yeah. The finally focused book kind of outlines a plan to kind of help parents kind of understand what some of these nutritional deficiencies might be and how they could correct them.
So it almost seems in the diet of children, because when you go to the grocery store, my thing, because I work with people for nutritional issues, and my number one recommendation to people is avoid the middle of the grocery store, because that's where all of the diseases, that's where all of the diabetes is, that's where all the problems are. And I would imagine that a lot of those foods, I'm talking about like the box foods, the highly preserved foods, the grains, the breads, the cereals, the high sugar, the soda. Do you think a lot of that it's these almost like anti-nutrients in those foods that, it's not that they're just devoid of nutrition, but they actually have these chemicals or these preservatives or whatever you want to call them in them that actually literally suck your life force out of you?
For absolutely, for some individuals, the sugar and the amount of sugar is directly correlated with the incidence of hyperactivity. When I started in practice, there was one study that the pediatric community did that said sugar didn't cause hyperactivity. So for 20 years, that's what, the medical community. But now we have very good research looking at the amount of, these sugar sweetened beverages associated with increased rates of hyperactivity. So you have the sugar sweetened beverages, and the mechanism is not only the refined sugar robbing B vitamins, but a lot of these sodas have phosphoric acid. So high phosphorus depletes the body of magnesium. And one of the most common nutritional deficiencies we see in ADHD is magnesium deficiency.
And you work a lot with minerals, is that right? I read that you do hair mineral tests. Can you talk a little bit about how that helps you treat people with ADHD and any other mental disorder?
Yeah, I think, take it one step back. It's really important in a functional medicine approach that we do as much testing as we can, because we can't guess. We don't know who's deficient in some of these nutrients and minerals. So we look at vitamin and mineral deficiencies. We look at the gut. We look at amino acids and fatty acids. But, one of the tests that is under $100 that we found particularly helpful is looking at trace minerals in the hair. And there we can look at minerals like magnesium, look at copper and zinc, and also the mineral lithium we can detect in hair samples.
So when you see a deficiency in one of these minerals, be it magnesium or deficiency in zinc or deficiency in lithium, I understand that minerals, they all work in ratios and they work in balances. So for you, is it a matter of sometimes just supplementing with those minerals and then kind of seeing what happens and then, seeing and then adjusting from there? Or is it a little bit more complicated?
It's a little more complicated, but actually supplementation is the key. The question that we have to ask is what else might be going on? So sometimes my colleagues who are learning about functional medicine, they might learn about one test, and then every patient gets treated based on the results of the one test. Let's say it's this hair mineral analysis, and they see low magnesium. But there might be other problems going on. There might be a dysbiosis or a gut problem. There might be a food allergy. So the more testing that we can do, the more confident and optimistic I can share with a parent or a patient that we can help them with this functional medicine approach. But yes, if there are deficiencies in magnesium or elevations of copper on a hair test or deficiencies of lithium, then supplementation would be part of a treatment model.
It's interesting you touch on the gut health issue, because I'm very fascinated with how the gut works in relation to the brain, especially considering the amount of neurotransmitters that are made in the gut. And I've explored this idea of psychobiotics, where, this branch of science where they're discovering ways to actually treat mental disorders and treat the brain through the gut. So, using probiotics and using enzymes and these sorts of things. Is that something that you use in your practice as well?
Absolutely. Again, not every ADHD child or adult would have a problem in the gut that's contributing to their symptoms, but there are some. And we can test for it, and we can look for it, and we can treat it. A common one we used to see a lot more common when every child was given 3 or 4 rounds of antibiotics every year for ear infections would be yeast and candida overgrowth due to the multiple antibiotics these kids were having when they were young. But we're also seeing gut problems with dysbiosis, overgrowth of certain forms of Clostridia, producing these chemicals that affect brain function, and we can actually detect it in the urine. And by treating these kind of abnormal biomarkers, we can treat the ADHD.
Yeah, the Clostridia is real fascinating. I was having a conversation with Dr. Kurt Wohler, who works with the Great Plains people and does the organic acids testing, and he was talking about the Clostridium affecting the dopamine beta hydroxylase enzyme, which essentially is what turns your dopamine into norepinephrine, and this contributing to a lot of mental disorders. And it's so interesting when you start putting in that second layer of, well, somebody goes in, be it for depression or anxiety or whatever it is, and then they're given an antidepressant when in fact their problem may be overgrowth of this bacteria. Correct.
Yeah, it's common, and it's treatable. Sometimes we would use high dose probiotics. Sometimes we would need an antibiotic to treat this elevation of this chemical from Clostridia. But either way, when we see that it's elevated in this organic acid test, I know that's contributing to this child or this adult symptoms. You can't feel well when you have this kind of buildup of dopamine. And when we treat it, patients feel better.
Yeah, it always comes back, because I've had so many conversations with, with a lot of doctors and practitioners, and it seems to always come back to antibiotics, because so many kids are treated with antibiotics. I mean, adults too. It's almost like antibiotics are this thing. And I see it in this time of COVID, especially too, where it's like this antibacteria, industrial complex we have, where it's, you walk into a place, you slather yourself with hand sanitizer, you feel a little sick, you pop an antibiotic. And I just don't think that people understand the downstream effects that these have. Perfect example, a family member of mine took antibiotics and then, 3 weeks later had SIBO. And I've heard so many stories very similar to that. And that just creates a whole new cascade of problems.
Yeah, we see it all the time in these young kids, or these kids that got antibiotics when they were, under 6, and then they don't develop symptoms where they seek treatment until they're 12 or 13. And people forget to ask, what was their course of antibiotics when they were younger?
Yeah, and it's easy to forget. It's very difficult to put 2 and 2 together when if you deal with something like skin issues. I mean, there's so many things tied to the gut, like skin issues or mental health issues or whatever it is. When you start to investigate a little bit, and then you look back and you go, oh my God, because when I was a kid, it was antibiotics almost every couple months. And I mean, for a couple of years, because I had this tonsil issue. It wasn't until I finally got my tonsils taken out that the whole issue kind of went away. But I can't imagine the damage that did, that I'm still dealing with these problems.
Yeah, the chronic use for multiple infections really are not taken into consideration around mental health issues. But as you described, there are more serotonin receptors in the gut than there is in the brain. And we know that our thoughts affect the gut, and our gut affects the brain. The science, is in its infancy in some ways in terms of the clinical implications. This one marker, Clostridia and the yeast, are two examples that we know we can treat and we understand. But we also have all this research about probiotics helping a wide range of psychiatric illnesses, even though we don't always understand the mechanism.
And so you're seeing candida in a lot of children then who come in with ADHD symptoms?
Absolutely. I would say when I started 30 years ago, it was every single day. I'd say over the last 10 years, it's less, but we see it all the time. Just because, in my career, the use of antibiotics have decreased for kids with ear infections. But we see it in kids and we see it in adults. Absolutely.
And do you see more adults nowadays with ADHD or complaining of ADHD symptoms?
I think one of the good things that the pharmaceutical industry has done, and because of the funding of research, it has made people more aware that ADHD doesn't disappear when you're 13 or 15, that the symptoms might change. You might not be squirming in your chair and being as hyper or impulsive, but ADHD in adulthood is a serious illness, and the consequences of untreated, the research we have is pretty dramatic. Higher incidence of car accidents, divorce, financial troubles, job insecurity, prison, aggression, crimes, traffic tickets. I mean, the list is quite long. And probably the most powerful one is depression and low self-esteem. So an adult with ADHD, particularly undiagnosed adult with ADHD, is really struggling, not really working up to their potential because they're usually quite bright, but following through is challenging. And untreated, it becomes a real, very tormenting source of low self-esteem.
From what I understand, ADHD is it's a matter of dopamine, right? Like because that's what the the mainstream medications treat is, the stimulants, the amphetamines, they're all for increasing dopamine. And all of the things you just listed, divorce, car accidents, jail, to me, that almost comes from a lack of dopamine. A divorce, like your marriage is never good enough. Jail, engaging in risky behavior, maybe because you need some kind of rush, some kind of excitement. And it's almost amazing to feel the opposite side of that when, you do have enough dopamine and you don't feel the need to be addicted to something or to engage in risky behavior or to just be content with, where you are. You're not physically looking around for alternatives.
Yeah, that's a very nice kind of example of why I use the term neurobiological illness, that kind of search for dopamine, if you will, is genetically driven. It's part of the neurochemistry, and we can treat that. We can treat it with medicines as a Band-Aid, or we can treat it nutritionally, or we could find out what might be contributing to that. So you're right, the medications are these Band-Aids that kind of enhance dopamine and norepinephrine. And we also can do that with nutraceuticals and amino acid precursors and vitamins and minerals.
When somebody comes into your office, I know that something like adderall is very prevalent, especially amongst adults. I know it's especially prevalent amongst students, in college and maybe even graduate school or high school. Do you find that people, they want to stop using Adderall and are looking for alternatives? How do you deal with that as a practitioner?
I think I have a slide with a doctor kind of screaming and parents, yelling at one side meds and the other side no meds. And it really is challenging because many of our patients and our parents are looking for that quick fix. And a medicine might be able to help someone focus and pay attention, in 5 days, but it's a Band-Aid. And so I'm not opposed to medicine, but certainly for my practice over the past 10 or 20 years, people that I would see, we would be looking for a functional medicine approach, looking for an underlying cause. Medications would be 3 or 4 months down the road, and that would be for young kids that are really struggling in school, and that school kind of performance is affecting their life and their self-esteem. At first, we want to kind of understand the nutritional deficiencies, understand if there are any other gut problems, allergies, or other toxins before we would use medicine.
And you'd mentioned nutraceuticals, you've mentioned magnesium and zinc. Are there any other, supplements or nootropics or vitamins or minerals that you particularly, and I know everybody's different, so you can't obviously give, and I'm not asking for medical advice, but kind of like more as a broad term question, what other of these supplements have you seen work for something like ADHD?
Sure. I mean, there's a lot, and again, the personalized approach is the most helpful. I start the book off with magnesium because I think that is the one supplement that I've found over 90% on testing our kids with ADHD and our adults are deficient in. So magnesium being number one, and zinc, because there's a very common high copper in our kids with ADHD. The mineral lithium, we use low dose lithium, 1 milligram, 2 milligram. And this is particularly good for irritable or impulsive kids or adults. Some of the road rage, some of the individuals that kind of can't stop themselves from getting into fights, either verbal or physical. The one kind of nutraceutical, it's not a vitamin or mineral that we've been using for many years, is called OPCs, oligoproanthocyanidins. Is the big term. It's the colors in grapes and blueberries and chocolate and green tea. So it's these flavanols that we've shown in some research early on in the 90s, and lots of research that's been written about, can really help improve attention. So grapeseed extract, pine bark, blueberries are all kind of forms of this flavanol phytochemical called OPCs.
Oh, wow. Those things you named off, I know those, but I've never heard them referred to as OPCs. That's very interesting.
Yeah, these were discovered years ago. They kind of work with vitamin C, and they kind of strengthen, they do hundreds of things in the body. They're powerful antioxidants, and as individual nutrients, they've gotten a little research, the green tea and the pine bark and the blueberries, and we've just found combinations of those OPCs to have the most dramatic effect on sustained attention and ADHD symptoms.
And you had mentioned lithium. Are you referring to lithium as in prescription lithium, or is that like lithium orotate that's over the counter?
Yeah, for most of the ADHD individuals, we're talking about lithium orotate, low dosages, 1 or 2 milligrams, sometimes titrating up to 5 milligrams. And this most helpful for, again, these irritable, angry, impulsive kids. We've had the kids that are kicked out of preschool, kicked out of private schools, just because they can't control their behavior. When you meet with them, they're remorseful. And they are quite articulate about not having the ability to stop some of these behaviors. And, on low dose lithium, oftentimes it's pretty dramatic. Within a couple of weeks, they're feeling better.
I'm curious. I wasn't planning on asking you this, but it just struck me as you were talking. Do you ever see mold as an issue for anybody with ADHD?
We see mold as an issue for every other disorder on the planet. And I think that for adults with ADHD, certainly for adults who did not struggle as children, but are now struggling with attention problems, that's where I've seen mold more of a treatment problem. I think for kids, it has not been as common as it has been in adults. So certainly the candida overgrowth we talked about, but the general kind of mold toxicity where we can test for these mycotoxins, I've seen less of a problem in children as I have with adults. Not that it doesn't exist, it's just less.
Sure. And you were saying that ADHD is a genetic disorder. Are there specific genes, if you run a genetic test, that you're looking for, or that you're specifically that contribute to this?
There's no genes that we know of would cause or contribute to ADHD. There's probably many genes, that affect dopamine metabolism, dopamine receptors. So there's, one gene, this COMT gene, that helps break down dopamine, and some individuals break down dopamine very quickly, and those individuals often. The research shows that they respond to stimulant medications, but they also respond to nutraceuticals that help support dopamine, like amino acid precursors like tyrosine.
Right. And again, then that goes back to, is your dopamine beta hydroxylase enzyme working properly? Because I know tyrosine, you can run into problems with something like tyrosine, building up too much dopamine if you're not able to convert dopamine to norepinephrine.
Correct. Yes.
Yeah. You had mentioned copper toxicity, and, I'm someone who runs the hair mineral test, and I have really just fallen in love with trying to understand how copper interacts in the body, because it's like a Goldilocks miracle. I know you were talking about copper deficiency. I think you were saying copper deficiency, but I've also seen it where there's issues with copper toxicity, and you can have two, or maybe you were saying copper toxicity, one of the two. I know there's issues on both sides of that, where you can have too little copper, too much copper, but it's got to be in the right ratio, especially when it comes to something like zinc. And it sounds like, especially for ADHD.
Yeah. One of the most common reasons that we see kids in our practice who were sent to us because they didn't respond to medications, and individuals with high copper typically have side effects to the stimulants because they get more irritable and angry because of likely too much dopamine. So high copper is common. It's common in kids with food allergies and irritability and aggression, and we treat it with zinc. And if you remember the Flint, Michigan crisis with lead in the water, well, after that, a number of other states, and where I'm from, Massachusetts, they started testing the water in the elementary schools. And in Massachusetts, not only did they test for lead, but they tested for copper. And what they were able to find, not that anybody did anything or got any press, but they did find high lead in a large percentage of these schools. But it was also high copper in the water fountains of the elementary schools, above normal range in toxic ranges. And that's just what we see all the time. And copper pipes, there's a lot of copper in the environment, and it affects behavior in very profound ways. Can't always determine without testing. So the testing is important.
Are there any foods like any foods or any other places other than water that you would see copper toxicity come from?
I think it would be hard. I mean, we sometimes have birth control pills. There are lots of other kind of things that can create a zinc deficiency, and that can cause copper to creep up. It's like a seesaw with zinc and copper. But I don't think there are any foods that are so high in copper that someone should be avoiding them.
Yeah. And I see copper in a lot of supplements as well. Like you can get a multivitamin or, there's a lot of these mineral compounds that have copper. Do you see that also as a problem? Do you want to look for, if you're going to take supplements specifically that don't have copper, or is there a difference with the copper you get there versus the copper you might get from water or?
No, and that's why a lot of people take this kind of shotgun approach, give these kids, 12 or 15 supplements of everything. And some of the times the high copper is the problem, because a child has high copper and you shouldn't be giving them copper in a multivitamin. So that's why, for me, the testing is the most accurate way of kind of personalizing a nutritional approach. Some individuals could take copper. Other individuals, it would make it very hard to recover and get better.
Yeah. And you've written a lot about disruptive mood dysregulation disorder, which is a new I never heard of that before, but apparently that plays with ADHD. Can you talk a little bit about what that is?
Sure. I mean, I never heard of it either when I went through child psychiatry, because they just made it up in, I guess, 2013, because there were a lot of very aggressive, impulsive kids that were being diagnosed bipolar disorder, which means if you're diagnosed bipolar at 7, the only tools we have would be high dose medications of antipsychotics or mood stabilizers. So when they kind of were updating the DSM, which is a psychiatric kind of diagnostic manual, they decided that to add this new category, DMDD, dysphoric mood disruptive disorder. So this category is based on this concept of kids that are irritable, that are kids that are oppositional and impulsive. So it's different than ADHD. And, we have no real model or mechanism for treatment. But these were the kids that were coming into our office. And that's where we found just what we've been talking about, that the vast majority of these kids have either high copper or low lithium or both. And we've seen these disorders completely turn around and resolve with these low doses of lithium and or decreasing the copper if that is one of the sources of the problem.
That's interesting because, when I think of ADHD, for some reason, I never think of the HD part. I always think of the AD part. Because when I was growing up, it was just ADD. There was no ADHD. I feel like ADHD was a thing that came around, I don't know, maybe 20, 25 years ago. And I can always remember my mom saying, because I had attention problems, and I was hyperactive, but I was never AD. I never put the two together. So, and it feels like as an adult, I have this natural tendency to have a hard time focusing, but I feel almost that's more of, being a victim of the environment, like getting sucked into the internet or one of the millions of distracting things, be it what's, entertainment or just like bright lights all around me. There's just so many things to like look at and be amazed by, like as a human, but when I hear about the behavioral issues, I almost feel like that's just a completely separate thing from the attention issue.
For many individuals, the attentional issues are the prime symptoms. For others, it's the hyperactivity, impulsiveness. One of I think the tragedies when I started in training is a lot of women, young girls, were not diagnosed because they were primarily inattentive. They weren't as hyperactive as the boys. So they were misdiagnosed and not treated till they were later in high school where they really started struggling. So yes, some individuals are kind of focused on inattentive and some have more of the hyperactive impulsive. You don't necessarily have to have all the symptoms that impair all aspects of your life.
Yeah, it's just so wild that, it gets categorized. And I understand there's kids who deal with this. When you see an adult dealing with something like ADHD, and typically, are they so far down the line that they've experienced some kind of, massive life event, be it a divorce, they've gone to jail, whatever it is. Do you see people who have been diagnosed with ADHD who are just kind of holding down normal lives and they're getting through, but it's almost like a struggle to them?
Yeah, I think the word is it's a constant struggle to kind of work up to their potential is kind of the way I would phrase it. I think getting by, sometimes it's choosing the right spouse or the right secretary, the right partner at work, because there are things that you do well. And for many ADHD individuals, it's the energy, it's the passion, it's the creativity. but it's not the structure and organization. So if you find the right job or the right partner, then life is okay. But if you're stuck in a academic situation that you don't like, or other work environments where those symptoms really impair this aspect of your life, it's just a powerful assault on your self-esteem and your ability to kind of feel good about yourself. And that, is a setup for depression.
Yeah, it almost seems like it's, you become a victim of, and I hate to use the word victim, but of circumstance, right? Like, there's a lot of people who they did their whole lives what they thought they were supposed to do. They went to school, they went to college, they got a degree, but their college degree plunged them into all of this student debt. And now they're in all this student debt. And so they got to get a job that they hate so they can slowly pay off their student debt and have insurance, and their insurance rates go through the roof. And if you have maybe something that happens, and then maybe you don't have insurance, now you're just in this continuous rut of having to do things you don't want to do because you've literally fallen behind the 8 ball. And then maybe that leads to some more of this depression, anxiety, ADHD versus it being an actual medical issue that you're dealing with.
Yeah, absolutely. And then, relationships are probably the hardest for many of our adults with ADHD because, there are terms like, lazy and just providing without that structure, kind of irritating spouses and friends, and people just assume you're doing it on purpose or you don't care, and not really being able to respect the neurobiology of that disorder. Relationships really struggle, and couples therapy for ADHD adults can sometimes be the most powerful medicine that I've seen work.
Yeah. Do you see any benefits in, and that's not a great question, but do you recommend any like lifestyle modifications or lifestyle things to try? Maybe like meditation, yoga, exercise, even like joining social groups of some sort, or traveling, do you see things like that helping without having to use, someone who wants to stay away from medication, or maybe they don't want to take a whole bunch of supplements?
Absolutely, all of the above. I mean, we know exercise is incredible medicine for depression and ADHD. Even some of the martial arts, we've seen great results. And mindfulness, we have research looking at mindfulness practices in both kids and adults with ADHD that help them focus and pay attention. We have research showing that time in nature enhances attention. So we do have all these kind of lifestyle mindfulness programs that do help those with ADHD. Absolutely.
Do you have any research, or have you done any researched at all the impact of sleep on ADHD specifically? Like maybe not just sleep, but like sleep quality or tracking sleep of in some way?
Absolutely. It's chapter in the book, and it's really important. ADHD individuals struggle with sleep, and the more impaired the sleep is, the more disturbed the behavior is. That's some of the deficiencies that we see, like magnesium is usually one of the factors of why sleep is so difficult. And it's one of the reasons why I share with both parents and adults that restoring sleep has to be a priority, because many of the symptoms aren't going to improve without figuring out the sleep issues. These kids very quickly get out of a sleep phase, normal sleep phase cycles, so they can start staying up at 1, 2 in the morning, and then they not getting enough sleep. It's a very important part of the treatment model.
Yeah. And then you throw in, the phone and the video game and all the screen time, and it just probably throws off the whole diurnal pattern and circadian rhythm.
Absolutely. Yes.
Yeah. How do you see the HPA axis? So like the stress response in ADHD, with cortisol and these stress hormones playing into ADHD?
Well, it's it hasn't been studied enough as it probably should have been. We know there was an early study on blood sugar levels, and kids were not able to. Cortisol helps regulate your blood sugar, and individuals with ADHD were not able to regulate the blood sugar. So as they ate carbohydrates and blood sugar went lower, they got irritable and aggressive and more impulsive, and they were able to kind of monitor that. I think low frustration tolerance and stress, inability to kind of tolerate stress, clearly has to be related to our ability to modulate stress through that HPA axis.
Yeah, and I'm sure the magnesium helps too, because magnesium is really good for relaxing and the adrenal glands. So,
yeah, a lot of the deficiencies we see are going to directly affect things like adrenal function.
Do you see any benefits to something like sodium or sodium bicarbonate or anything like that?
Not typically. Sometimes kids that are prone to food allergy. In the old days, we used to use sodium bicarb, but typically not routinely recommending sodium.
And do you see food allergies playing into a lot of these issues you see, maybe even for adults? Because I know sometimes for kids, the food allergies, I know there's like the stereotypical kid with the peanut allergies, and now everyone's allergic to gluten, which makes sense. But adults, I find, are dealing with a lot of it almost seems like the food allergy reaction is more severe in a lot of adults who have it's been an underlying thing. And now that you start hitting your late 20s, your 30s, even into your early 40s, some of these food allergies, they start to present themselves not just as gut distress, which could affect ADHD, but also in the mind too, and create some brain fog and ADHD type symptoms.
Sure. There are a couple concerns around food. One is, the kind of allergies that we're seeing from peanuts and the anaphylactic reactions. Those are called, immediate hypersensitivity, IgE allergies. The allergic responses that we're seeing that are probably related to behavior are called delayed hypersensitivity, and those are IgG mediated allergies. So they're different, but we can test for them and we can look at those. And then there's a subset of individuals that really don't tolerate dairy or gluten, not because of an allergy, but because they don't break down the protein, the casein and the gliadin completely. And these breakdown products they're called exorphins, these morphine analogs that can cause brain fog and inattention and irritability. And that's the overconsumption of dairy and wheat. And it's very common, and it's not an allergy.
Right. What would you call it? Not a sensitivity. It's just a reaction to the protein.
Yeah, and it's a deficiency or a lack of efficacy of an enzyme called DPP4, and it's actually a zinc-dependent enzyme that breaks down these proteins. So we can give patients supplements of this DPP4, and oftentimes these are individuals that have the high copper and are deficient in zinc. So we're giving them the enzyme, we're giving them zinc, we're asking them to stay away from dairy and wheat for a brief period of time. And sometimes these symptoms can resolve, in a few months.
Yeah, I find, it just seems like such a good practice anyways to stay away from, especially wheat, along with the gluten and then the wheat proteins, but then you also get the high glycemic response, which, triggers the cortisol and brings a whole new cascade of issues.
Yes, it's kind of an endless cycle, and it's really important to tease apart, what are the priorities? And I think parents struggle sometimes when they hear information like this or read about it. They try to do everything, and I think it's really important that there's kind of a systematic approach of how to treat a child or an adult with ADHD without medicines.
Do you ever work with anybody or have you done your own kind of research, maybe within your practice or outside of your practice, with like the ketogenic diet or any kind of more rigid dietary practice?
But I think it's very clear. And a woman who I remember a meeting in the 1990s, she sent me her PhD thesis on glucose tolerance curves in, like 100 ADHD kids. And they were all abnormal. So I think most of us who've been seeing these kids, and many parents, these kids do not tolerate carbohydrates well. And a high protein, or if we wanted to use the word ketogenic diet, I think would be helpful for 90% of these kids. No research to support it, but that's just my clinical opinion. What I have seen is as we decrease carbs and sugars, behavior does improve.
Yeah. And the protein also gives you the amino acids, which are the precursors to the neurotransmitters. So that probably helps too.
Absolutely. Yes.
Just a couple more questions, because I just thought of amino acids. Are there any, I know amino acid therapy can help for like specific amino acid therapy recipes can help for certain things like addictions and depression and anxiety. Are there any amino acids that you have used for something like ADHD specifically?
Yeah, absolutely. I mean, it's the same model. These amino acid precursors, like tyrosine, phenylalanine, and they go on to make dopamine and norepinephrine in the brain. So if we're trying to support dopamine without medication, we do use these amino acid precursors for some phenylalanine, for some tyrosine, with the cofactors, vitamin B6 and zinc. So we absolutely use the amino acid precursors to help support the synthesis of these neurotransmitters.
That's really cool. Well, Dr. Greenblatt, this has been very informational. I really appreciate your time. I've learned a lot. Before we jumped on the call here, I read your 2 free books on your website about the copper toxicity and the lithium. So it was interesting to hear you talk a lot about those 2 things, especially. And it seems, I don't want to make it sound easy, but it seems like the way you explain these complicated issues, it's almost empowering in a way to know that, when somebody feels like they don't have control with something like ADHD, that there are these more simple steps you can take to at least start to trend in the right direction.
Yes. I mean, I'm very hopeful and optimistic when I see new patients, and if we can do the testing and try to individualize a treatment plan, we often find something. Doesn't mean medicine and other therapies aren't needed, family therapy, parental therapy, behavioral therapy. But if we can get to some of these biological causes, we can just make life much easier for those that are struggling with ADHD.
That's very true. Before we sign off, is there anywhere that you can send our listeners or viewers to learn more about you, learn more about your programs? If somebody wants to work with you, where's the best place for somebody to go, online or otherwise?
Yeah, our educational program is Psychiatry Redefined.org. And there we have courses on ADHD and fellowships on ADHD, as well as many other programs for kind of helping both patients and clinicians understand this functional medicine model for mental health and mental illness.
Great. We'll link to all that after we put out the podcast in the show notes, and you'll be able to catch those on holisticnootropics.com. Dr. Greenblatt, thank you so much for joining me today. Stay warm up there in Boston, and hopefully we can do a round 2 sometime.
I appreciate it. Thanks, Eric. Keep
Absolutely.
up the work.
Thank you so much. And
Bye-bye.
for you, listener and viewer, thank you so much for tuning in. For more on Dr. Greenblatt, be sure to check out the Holistic Nootropics show notes for links to everything we talked about today. And we'll catch you on the next episode. Peace.
Thanks for listening. For more brain-boosting info, in-depth articles, and show notes, check out holisticnootropics.com.